the taxpayer dollars are going to every one of these agencies. But more importantly, what have they accelerated in mental health? How have they supported suicide prevention? And one can say that they have not.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. Just speaking with a really excellent consultant we had reached out to on LinkedIn to discuss some of the policy changes that are happening right now, how to prepare for policy changes, how to work with internal and external partnerships, and a variety of other discussions. And so I want to introduce you all to this special guest, John Sun. John, please introduce yourself and what you do now.
Sure. Thank you, Cole. My name's John Sun. I am the Chief Growth Officer for Sun Curating Group out of San Antonio, Texas. I've been in healthcare for about 22 years, all within the federal government. I've been supporting the federal government for about 31 years, all the way from my first career in architectural design and construction, and now leading into federal health as a strategist for not only companies, but also for federal customers.
It's great to have you on, and I really appreciate the breadth of your experience. And it really does for the audience. It stretches from working on, like you said, the hospitals and facilities with architecture and those government kind of contracts and whatnot, all the way up to working in medical device. And so it's a really large breadth of experience. I
Thank
wanted
you.
to ask kind of the first question. What do you see as being the major problems right now that, healthcare institutions are facing?
Great question. I truly believe there's many, many things, but if I have to pick one, is that our policy doesn't align with the needs, doesn't align with how it should help people, especially with the disparate population. And the policies are outdated. And I'll give you a perfect example of, telehealth has been around over 20 years. The idea is that if I travel to a foreign country or another state or another city, I could receive medical help and advice through my own doctor, through telehealth, through my mobile phone or laptop. Well, it wasn't until recently, right before COVID, thank God, that the policy changed, that the access to telehealth was much better. Before, I live in San Antonio, if I was visiting California, I got sick, I couldn't even see my own doctor through telehealth just because of the policy, how that physician or my physician gets paid and get reimbursed. Well, luckily, we actually, through Telehealth Association, has some lobbyists and got that passed. And now the policy is actually more robust and designed to help more people. It's still not 100% the greatest, but at
Mhm.
least it's better. And we were actually prepared for COVID, but right now we really need to look at Center for Medicare and Medicaid to see how they could do a much better job in giving providers more access so that the patients could have more access in rural health.
Do you think that's really, because I mean, I agree. Rural health is a huge issue, and it's a huge issue because too, other countries don't operate this way, and it puts us kind of at a competitive disadvantage, right? When, in one country, your insurance will work throughout the whole country and all the different districts, and yet in the United States, it very much is specific to geography and what state or even what county you live in. I know that there's a lot of issues, people vacationing, right? They spend half the time in Florida and half the time in New York, and I know that that's a headache for them to go through. And so, and like you did with rural health, that's the biggest problem, right? Is out in the rural areas as farming, especially gets more and more efficient. You have fewer and fewer people per acre of land in those areas. But what do you think is going to happen? And I guess part of the difficulty too is how can you tell? How do you actually learn this information? Because that's one of the biggest issues I see is not just that we don't know what's coming, but we find out so late in healthcare.
That is right, and that is the one of the biggest concerns coming out of COVID is that the hospital systems has closed a lot of the rural clinics and hospitals just because they couldn't see any specialists, so they're losing revenue. So they're closing down all these clinics and in the rural areas. So One of the things that I think that, again, politics aside, I truly believe that things are going to progress with Mr. Musk, with his Starlink, because one of the biggest Achilles heels in telehealth is broadband.
Mm,
And people living in those areas, for Native Americans especially, they not only do not have broadband, they can't afford good and stable broadband. So to bring in telehealth during COVID, some of the patients has to drive to a Starbucks or drive to a library or hospital that is actually closed for normal patients, but they could pick up the Wi-Fi and get an engagement. But now with more advanced Wi-Fi. I think Verizon won a huge deal under the government to bring in C-band. But again with policy, right? They, even though they won the contract, they can't really execute because of the policy and the restrictions under those policies to execute to help with Native Americans in rural areas. So I think it starts with good people, good-hearted people to look at, okay, how can we improve and bring in technology so they could bring in telehealth or even remote teaching. I mean, during COVID, I was going crazy because my daughter had 5 different platforms that her different teachers want to use, while
mm,
these people don't even have broadband. So,
yeah.
so the idea is to start with a need, and then the need translates into a policy, and then the policy gets executed with private companies bringing the solution. But that is also another Achilles heels, because traditional government contracting is not sustainable, meaning it's not long enough to bring in these technologies. There's a lot of protests during these procurement process, and then sometimes it's lowest price technically acceptable, so the winning contractor doesn't necessarily have the best solution. So I think little by little, we're hoping that with this new administration, that they're going to think outside the box, all the way from procurement, all the way back to thinking about how can a policy improve the to access to care.
And it's, we're recording this on January 22nd. Of course, it'll come out later for the audience, but just yesterday, of course, the CEO of Oracle, you probably saw it, spoke with Trump and actually said on a native reservation, the kind of tribal medical service will be able to get and provide the same level of care that somebody at NYU, or Mount Sinai or whatnot, or Stanford would be able to get. And that was, of course, with Elon with the Starlink. Starlink, as you're mentioning, it's still very slow with Verizon C-band. The actual Starlink is fast, but but the service that they're providing is slow. So you're right. It's these policy, these intricacies, the challenges. And we had talked before this episode, and one of the examples you gave regarding, I believe it was an MRI machine. But that's kind of the question is, let's say you are a small institution right now, you're a small hospital. How can you take advantage of kind of what's going on with the change in the government right now to really try to get the services improved for your community?
Great question. It is a great concern, and but I really think there's a light at the end of the tunnel, because Vivek and Elon, starting with the Doge, they're all about efficiency, and they're all about value, more importantly. So these two gentlemen are billionaires for a reason. They know how to get things done, and I always joke that don't bite the hands that feed you. 31 years in federal government contracting is what stifles creativity, stifles agility, and stifles innovation. I truly believe these two gentlemen became billionaires because they know how to work with the federal government, and more importantly, leverage the public-private partnerships versus a traditional government contract. Like I said before, this mechanism is long-term, is sustainable, is adaptable to even leadership and presidential changes, but also scalable. Can you start with a single clinic and then all the way to a big healthcare system? Can you start out with a community and then to a more of a tribal state or region? So I truly believe that this is coming. And The clinic needs to also understand that, hey, this alternative acquisition mechanism is out there, is used all the time by the military, by the federal government, but is traditionally aligned to a road, a bridge, a building. but we must learn how to build a solution underneath this public-private partnership so that this clinic to have a partner for a long time, to have the MRI and the devices, to have all the software upgrades, to have all the training that's necessary for even the visiting nurses and the physicians. That way, not only is the contract mechanism is sustainable, their solution is also sustainable.
And like you said, you're resilient to political changes as well when you pursue it that way, regardless of kind of the presidential changes or whatever happens, you become more resilient because it's that long-term contract. And can you give that example you gave to me yesterday about that 18-year contract that you'd worked out?
Yeah, so many tribal hospitals and even rural hospitals, they have much need, but they don't have a lot of funding. So to kind of understand what they need, first you have to understand and go there and listen. Not many companies go out and listen to what they need. They just say, "Hey, oh, I have an MRI machine to sell you." That's it. But what I mean by human-centered design and co-creation is so we must go to where the need is, to listen to the community, to listen to the physicians, to listen to the directors of these clinics and hospitals. What do you need and why do you need it? And maybe it's not an MRI, maybe it's a CT, but after you go through the requirement process and listening, then you create a partnership and say, you know what? I know you don't have a lot of funding, but you have guaranteed funding, whether through a grant, through a hospital, or through federal government. Now it's time. How do we, when there's a will, there's a way. How can we leverage this long-term public-private partnership? Normally is 15 to 20-year term. I've supported 3 deals that was 50-year term. And the clinic basically said, you know what? I do have guaranteed funding. I can't afford 3 MRI machines. Well, I'm like, well, let's make this deal. We supply 3 MRI machines with unlimited software upgrades, with unlimited training, knowing that staffing retention and staffing shortage is a huge problem. So now instead of having me as a vendor, let me be a partner of yours. And it was delivered within a month, and they're happy, and the company, films, they're happy as well. So this is
Mm.
how it works, and I truly believe moving forward, especially in health equity purposes, there's got to be a partnership, and we got to stop selling. And going back to your first point about Native American and the Oracle and this AI agency that Trump is pretty much standing up. I also challenge the people. The Native American people needs to rise up and trust the outsiders once and for all, because I get challenged a lot as a Chinese person. Why are you here? When I was with Philips, well, you represent a Dutch company. Why are you here to sell? Because we don't trust you. Well, they need the help, and I truly believe through co-creation, let them tell me what they need versus me telling them what they need. You form a trust, and that's how a partnership is formed. And because of that, I was called an ally in Montana. So that's, I think we need to benchmark and help all the disparate populations, not only in this
Mhm.
country but around the world.
And you still are involved down to this day, I believe, right? With the community there, you have relationship.
I am. Even though I left Phillips, I am still part of the Native American community, meaning that I have supported about 18 different tribal communities and trying to bring solutions and it doesn't even have to be healthcare, but it could be social determinants of health. My wife and I are donating a water drill to the Navajo Nation. So now for once and for all, they could get fresh water, clean water. I can't believe that, when we talk about brown water, we automatically go to Lansing, Michigan, but
Hmm.
these tribal communities been living with brown water all their
Mhm.
lives.
Wow. And why, I guess what I wonder is why do, when I speak with some executives, they shy away from these public private partnerships. Nonprofit hospitals, they don't really want to create, official partnerships like this over a long term. Um, but I see a lot of advantages. Why is that? How do you overcome some of the objections?
Yeah, that's a great question. It's also been what I have observed is that first of all, they don't know what it is. They do not know how a public-private partnership works, because at the end of the day, they're like, oh, long term. They like to stay away from long term just because they need the revenue today. They have shareholders to meet and everything. But during the COVID years, everyone had a health equity strategy or health equity narrative. But sometimes I get discouraged because you say something, but you don't act on anything, right? So I think we must challenge the C-suites of these hospital systems and say, you know what? Do you really preach? Are you only preaching, or are you really truly meaning that you want to help? If you want to help, then you gotta. This is a long term, because you can't cure this overnight.
Mm,
The spare population, and there's so many, but guess what? They have the data because they're in their own communities. So
yeah.
why don't you leverage your data, see what it is? Is it breast cancer? Is it prostate cancer? Is it mental health? Understand your own data, and then how do you leverage that data to help your own disparate population in your own community, and then solve it? But that's not an overnight thing. So that's why I think, to answer your question, they shy away from it. Is one, they don't understand it, and then two is all about the dollar.
I wonder if some of the challenge might be also kind of not recognizing that brands like Philips, like GE, Siemens, that they're more flexible than what we think, right? Sometimes we think, oh, an MRI machine costs this much, and this is what you're going to pay, and there's no negotiation or flexibility. How do they approach that? Like, let's say I was a rural hospital and I have no money or very limited funds, but I really desperately need a CT machine or another one of these very expensive machines. How do I approach Philips or GE or one of these other companies?
That's a great question. I can't speak for other companies. I can't even speak for Philips where I left. But at the end of the day, you must have passionate people. Must have people that has a purpose, a deeper purpose, a purpose in life. And through that purpose, and that's how I was challenged at Philips, is okay, how do I really help? I have all the solutions that a mankind needs, but yet they desperately need it, but I can't get it to them. So it takes someone with creativity first. It takes someone to, challenge the C-suites, and it takes someone to really care and visit that community and say, hey, is the MRI really what you need? And then you co-create a solution together. You don't tell them what you need. You don't tell them the terms, or do you really need AI when you don't even understand it? So those are the type of things that, if it just takes one person to care, and with the right purpose, is to visit that community. And you know what? A lot of the companies don't have that resource, because all they want that person to do is sell, 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 sell.
And this is why you kind of have gone into your new role now, right? Where you're no longer kind of beholden to the sales of a big company, but at the same time, you're still able to do that. Is that kind of where you found yourself heading as you went through your career?
That's exactly right. I'm not knocking on these large Fortune 500 companies. They have been successful for a reason. So my goal and my purpose in life is to connect the dots now.
Mm.
So knowing that there's Philips and GE and Siemens and the Booz Allens and Leidos is out there, my goal is to connect the dots and say,
Yeah.
hey, this community needs X, Y, and Z. Philips, you may have X, GE may have Y, but Booz Allen may have Z. Let's put it all together. Let's form a consortium that we could really help the disparate population, knowing that for the what you need is a long-term contract. Let's do it.
And do you think that there's going to be some initial panic or concern as some of these maybe government funds or government opportunities go away with Elon and Vivek, and as it shifts more towards this private thing? And what should people do instead of panicking? What should their kind of first step be?
Yeah, I mean, and that's a great question and great thought, because under the President Trump's first presidency, he shut down the cancer moonshot.
Hmm.
Everyone said, "Wow, geez, why would any human stop a cancer research opportunity?" Well, again, it's all about measurable outcomes. A lot of the critics of the moonshot is like, "Well, nothing has happened. We're just pouring a lot of taxpayer dollars, and there's really nothing that accelerated cancer research,
Mm.
therapeutics development. So why are we pouring more money into this program?" So there's always a left and a right side. But if you're in the middle and say, you know what, instead of panicking, can we show this administration what we have done?
Right.
And if you don't, then yeah, you're going to be under the microscope, and that the funding will either be much smaller or be cut altogether. So that's the idea, is for me to support these government agencies. Like, what, instead of complaining and panicking, what can you show the administration or the Doge your measurable value?
And does that go back to why you said we need to make sure that we're co-creating a solution and not adding things like AI even when we don't know what it does? Because then you end up with this bloated kind of MRI machine that has all of this, stuff attached to it that you don't really need. And then you maybe are missing out on things you do, like the nurse training for rural areas that have a lot of frequent travel nurses and things like that.
Yeah, what the federal government does best is react. And when you have various populations like the veterans and Native Americans and others, even African Americans and Asian Americans, when we have an increase in mental health, substance abuse, suicides, here comes SAMHSA, right? The substance abuse mental health agency is, now they have all this funding, billions of dollars, but yet the VA also has a mental health program, a suicide prevention program. Oh, so does NIH, and so does Indian Health Service. So you have all these agencies wanting to do good, but they're not coordinated. They don't even communicate, but yet the taxpayer dollars are going to every one of these agencies. But more importantly, what have they accelerated in mental health? How have they supported suicide prevention? And one can say that they have not. So it's really sit down and telling President Trump, this is how we're going to propel and prevent suicide prevention to this and that. But I'll be honest with you, th- the veteran populations, they're dying every day. They're killing themselves every day because it's whatever we're doing right now is not working.
Yeah. And so we need to then figure out by collaborating with the veterans themselves. I think
Correct.
that's probably one of the biggest takeaways from this is all shareholders, stakeholders need to be in the room for the decision instead of leaving out our patients or leaving out the vendor or leaving out the CEO. We need to bring everyone in together. And that's what you do as a consultant is you take your time that, the companies and the public might not have and really invest on bringing those people together.
Exactly. Again, it's about alignment or realignment, and sometimes the solutions is right there in your fingertips, and we just don't know how to leverage that or modernize that. On this same topic, there's a reason why the biggest square footage when you enter a VA hospital is the waiting room, the lobby,
Mhm,
is because these veterans love to sit around and just talk about war stories and share stories.
mhm.
That's how they release their stress and anxiety. While there's a bunch of money being poured into suicide prevention, and most of the innovations is an app.
Right,
Well, if you're trying to commit suicide or wanting to commit suicide, are you going to really reach for an app?
right.
Right. So
Yeah, there's a
why
lack of that human connection. Yeah.
exactly? So why not bring that waiting room or that lobby into a household?
Mm,
How can each waiting room have a simple camera where you could listen, or maybe make it more quiet? I don't know. Maybe that's not a solution, but all I'm saying is that I truly think sometimes we look into technology and sometimes technology is not the right solution.
I appreciate that. So, and I appreciate you coming on today. I know that we're at time, but I think that it's really important to kind of reiterate we have a lot of changes coming with the kind of changes in politics and like what you're saying, it looks like it's going to be very efficiency goal orientated. At least that's what they're what they're saying a lot is efficiency. And we know Elon Musk says that he's quite efficient at his factories. We know Vivek is the same way. And you're right, they do prioritize those public private partnerships. So we need to work with the actual public and the stakeholders to try to get that efficiency as things go on. And of course, we'll link your website and your LinkedIn on the episode so that people can reach out to you and get further advice. But this is really important. It's important for me as well because I am just starting to delve into private public partnerships. So I couldn't be more appreciative of your time, John. Thank you so much.
Yeah, thank you for this opportunity. I hope it gave some insight as far as what's could be coming, and hopefully, like I said, my purpose is to help people, help companies, but agencies, but more importantly, the people in disparate populations is my purpose. So I really appreciate the opportunity.